Hello everyone, and thank you very much for joining us today. My name's Deborah Garlick from Henpicked Menopause in the Workplace, and author of the book Menopause, the Change for the Better. And I'm delighted to welcome back Dr Tonye Wokoma to the session today. And it's all about testosterone, which seems like a trending theme at the moment. I see testosterone wherever I go. So Tonye is going to be answering some really fundamental questions for us, like what is testosterone? How do we use it? How does it affect us? And what are the signs of low testosterone? So welcome, Dr. Tonye. Thank you for joining us today.
Thank you, Deborah. It's always a pleasure to have this conversation with you. Thank you.
I'm sure you're going to get a lot of questions, Dr. Tonye, because and my colleague Sally is in the background monitoring all of the questions as they come through. So please do ask any questions that you want, and we'll have time at the end of this session to come back to those questions and answer as many of them as we possibly can. So Dr. Tonye, first of all then, as human beings, we all have testosterone, right? It's not just something that males have. And actually, that's a revelation for many of us. We women have testosterone too.
Yes, no, absolutely. Like you said, it's really been of recent that more and more people have become aware that women do have a bit of testosterone. We don't have as much as men, which is good, but we have enough for it to do what it is it needs to do in the body. And the thing about testosterone is that it can be essential for things like libido and energy. But yes, certainly everybody does have a little bit of, women have a little bit of testosterone, but certainly much less than men.
And now it's interesting, isn't it? I know we're recording this on the run up to Valentine's Day, and there's been a huge amount of interest and people registering for this session. What does testosterone do for us? Well, as women, particularly me.
Yes. No.
Sorry, particularly women. I mean, not particularly me. I'm giving myself away there. For me, if you want to increase my sex drive, I have to say you can always go for chocolate. I know my husband's listening in the background, but testosterone, and is it just about libido, or is there more that that testosterone does for us?
So testosterone is important for several things. And when we talk about libido, Deborah, it's important to know exactly what a woman is referring to, because what I've found in clinic is women are talking about low libido when it could be all sorts of things that's going on in their lives. Sorry, that's my phone. I shall just turn it off. So testosterone, the main thing that we have evidence for is testosterone is useful for libido. And when I say libido, I mean low sexual desire. Now, of course, women have all sorts of different sexual problems that they come with. So when they come to see a clinician, it's really important to find out, is she talking about low sexual desire, or is it lack of arousal, or is it vaginal dryness that's making sex uncomfortable and that's causing a woman not to be interested in sex any longer? Or is there a problem with orgasm? And that's one of the things that I try and do when I see women in clinic talking about low libido, is what exactly are you talking about? But testosterone, back to your question, can be useful for low libido. There are some studies that suggest it may be useful for energy, but the evidence isn't as strong. Again, with libido and energy, these are things that are affected by a multitude of factors, all sorts of different things. So it is sometimes trying to understand what else might be going on, and if testosterone may be beneficial in a woman. We do know that testosterone does begin to fall from our late 20s and 30s up until we get to the menopause. And in the menopause, the ovaries still produce a tiny amount of testosterone, but for some women, that's all that we need, really. So it's a fairly complex issue, but yes, testosterone is produced in women and it can be useful. Some people talk about muscle strength and muscle mass, but again, we don't have the evidence for that in the literature at this time.
It's interesting you say we don't have the evidence, because sometimes when I'm reading upon testosterone and I see articles coming through, it looks like, you know, women should have estrogen, progesterone and testosterone all prescribed at the same time. Is that not the case?
The guidance that we follow suggests that a woman should be well estrogenized in the first instance. So it's back to the question of what you said, what's a woman actually complaining about? Now, if she's tired, if she's flushing, if she's sweating, if she's put on weight, she doesn't feel sexy or attractive, or there might be lots of other things going on. She may not want to have sex. Her libido might be low. So what we try and do in the first instance is try to make sure a woman is well estrogenized, make sure there's no vaginal dryness, make sure there's no other relationship issues which could be impacting on her libido before you go on to do testosterone replacement. So it is, yeah, some people say give everybody the same thing all at once, but I try to do things one at a time so that if you get side effects with one, we know what exactly is going on.
That's really interesting. I've never heard that word, well estrogenized. I shall bear that one in mind. But you're right, it's a complex issue, isn't it? You know, so what somebody could be experiencing and presenting with, you know, it might be hormones, it could be something to do with general life stresses, or maybe you've got caring responsibilities or children at home and you just don't find the mood. Yes. So it is worth, or maybe even you're struggling that much with menopause symptoms generally, you just don't feel in the mood.
Absolutely, absolutely. If you're overwhelmed, stressed at work, we know that menopause is a biopsychosexual phenomenon. It's not just about the hormones, it's about what else is going on, as you've said, Deborah. So again, it's important to use the hormones, but use it appropriately.
And as you say, research and evidence is different than, you know, it's not actually proven yet. So what you follow in the NICE guidelines might be different to what you read in the press.
Yes, indeed. There's been a lot of media attention about testosterone. And I think it's important that women are aware that it can be helpful, because for some people, that's the final piece of the jigsaw puzzle in their, you know, hormone replacement management. But it's not effective for everybody, testosterone replacement. And therefore, it's important to understand exactly what we're trying to use testosterone for and what we're hoping that it will do for us.
So when it comes to what are the signs then for low testosterone in a woman?
The sort of most common sign that women complain about, the thing that women come to see us most for, is low libido, as we've discussed. Some people have read about testosterone and want to see whether it might help with brain fog, focus, concentration. Again, as we've said, we don't really have much evidence for that. There is evidence for libido issues, but it's trying to untangle what exactly a woman means when she is experiencing low libido, and if there is anything else that could be contributing to that low libido at the time. Before we start them on testosterone replacement. I usually would want a woman to be started on estrogen and progesterone or progestogen in the first instance, and to make sure that that is right, because I explain to women that not everybody will benefit from testosterone replacement, and for some people, they do get side effects with it as well. And some people don't need it, actually. Some people don't experience the signs of a low libido.
It's funny you should say about the side effects, because mine would be, okay, I would associate, will my voice deepen? Will I get facial hair? Are those the sort of side effects you mean?
There can be side effects of unwanted body, facial hair, and it can be quite dramatic, actually. Those can be fairly frequent, so I always warn women about that. It's quite rare that you see a woman whose voice has deepened, or again, one of the rare side effects is increase in size of the clitoris. But of course, if we don't use the testosterone replacement as recommended or appropriately, then there is a possibility, if used long term, that they could get some of these side effects. Other side effects I tend to warn women about is getting spots, getting acne. And it's just something to look out for. If they begin to notice side effects, I usually say either reduce the amount of testosterone they're using, or they can stop it, and we can then look at restarting it at a lower dose at another time.
There's some interesting side effects there, isn't there? Because I know one of my symptoms was menopausal acne. I really don't want to go there again. So for me, that's really quite terrifying. So that, as you say, what the doctors do, what you do is kind of look at estrogenizing, checking in, does that actually resolve whatever somebody's experiencing? And then it's an extra one in the toolkit. So because I know there's a lot of talk about there not being a testosterone for women, and it being the male testosterone that is that still the case, that is adjusted?
We use it off license. We don't have a preparation in the UK. There is a preparation that can be imported from Australia. That can be used, but in a lot of places in the UK, we wouldn't be able to prescribe that on the NHS. But we certainly use off-license what we give to men. We use it much more cautiously, and there's different brands that can be used. We just titrate the dose to ensure that the woman is getting the appropriate dose. We also ask that they have a blood test done before starting, and usually about 8 to 12 weeks after they've started the testosterone replacement, to be able to monitor their blood levels. But also, if they have a blood test before they start, we'd be able to see where their testosterone is at, and give advice if testosterone might be helpful for them.
Is that available on the NHS as well? Because I know My Menopause Centre is brilliant and has access to absolutely everything. But is it available for those of us that are on being treated through the NHS?
So testosterone is available on the NHS. In a lot of places, it has to be initiated by a specialist. So they'd have to, from primary care, would have to refer a woman into a specialist menopause clinic, mainly because of the things that we've discussed. Is it actually testosterone replacement that's required? Is there other things going on? Is the woman on the right HRT? Do we need to make other adjustments? So in a lot of places, it needs to be requested by a specialist in a specialist clinic before the prescription can be taken over by a GP in primary care. So I know women, a lot of women complain about trying to get testosterone and the difficulty they have. But, I just say try to persevere. It is available on the NHS off license.
Thank you very much. And I can see so many questions coming through. So I'm going to ask my colleague, Sally, who's been checking in on the questions. Lots of interesting questions there, Sally.
Yes, so many. And just again, as we always say in these sessions, thank you so much everyone for sharing and supporting each other, sharing what's working, what experiences they've had. We know that makes a big difference to everyone, so thank you. So there's a lot of questions around the right dosage. So how does someone know what they should be? What's a small dosage? How would you normally approach that if someone was trying this?
And it would depend on the brand of testosterone, Sally, that's being used, because the different brands come in different concentrations. So it's really important. So what's happened of recent as well is that one brand has been out of stock and a woman has been switched to something else. And it might not be the same concentration in the different brands. So it depends on what she's given to use as to what would be the right dose for that woman. So there are about 4 or 5 different testosterone preparations available in the UK that we can use in women off license, and depending on what they're using would depend on how frequently we would suggest that they applied the testosterone gel.
Okay, and is there a particularly best place to apply it?
I usually ask women to apply it on the tops of their thighs. It's easy to see if you get hair growth when you apply it there. But I know not everyone, some people put it on their tummy. So the general advice, I think, is sort of tops of the legs.
Yeah, excellent, fantastic. Quite a few people have asked if they're not able to take estrogen or other forms of HRT because of cancer treatment or anything like that, is it possible to just take testosterone, or is it only as an addition to HRT?
Testosterone has been given to women without using HRT, but we do advise caution because a little bit of testosterone is aromatized, is changed into estrogen in the body. So in a lot of women who can't use HRT, it's because they're trying to avoid estrogen replacement. But we have seen that testosterone, we have sometimes, quite rarely, used testosterone in women on its own without using HRT first.
And if someone's really struggling with their menopause symptoms and they're not able to take HRT and maybe testosterone isn't possible, what are some of the key things that they could really try and focus on to manage those? Because I know that can feel really frustrating.
Absolutely. If you know, it can be horrid if you're really struggling and nothing is working, especially if you've been on HRT prior to that. So again, you go back, take a step back. What else could you do? Lifestyle management, which it sounds like, oh, but you know, I've tried that, I've tried diet, I've tried exercise. But again, just looking at it in you know, a bit more detail, what else could you do to help with some of those symptoms? CBT, there is evidence that cognitive behavior therapy can be very helpful for menopause symptoms. So if you can find a service that might help you with that, again, that might be helpful. There are alternatives to HRT we sometimes use in women who are, for whatever reason, unable to have or don't want to have hormone replacement or testosterone replacement. And we would always discuss that with women depending on what symptoms they're experiencing.
Yeah, fantastic. And people have asked around blood tests of actually testing testosterone levels. Is that something that's recommended? Do GPs do it? Is that a way of understanding if there's a lack of testosterone, or is it a bit more complicated than that?
Yeah, I tend to say we're treating the woman, not the blood test. So I wouldn't suggest recommending a blood test unless the woman does have symptoms that may be due to low testosterone. So for example, if she is complaining about a low libido or you know, a lack of energy, then I'd suggest having a blood test to see where her testosterone levels are at. If we did a blood test, if a woman isn't complaining about these things, we get into this possibility of treating women where actually they may not need testosterone treatment. Sorry.
It's okay. And we've talked about the impact of testosterone in terms of libido, and people have asked, can it have an impact on other things? Like the few things that came up were mood, brain fog, bone density, and thinning hair were some that have come through in the questions.
I have had women who've reported back to me that testosterone has been really, really helpful for the brain fog. It's been helpful for focus and concentration. We need more studies on testosterone replacement. At the minute, there isn't the studies that demonstrate specifically that it can be helpful for that. We do think that testosterone would be useful for bone density and bone mass. Whether testosterone can be helpful for hair thinning or too much testosterone can lead to thinning of the hair, again, it's difficult to say. So it's trying to tease out what could be a symptom of a woman's having low testosterone and what could be a symptom of other menopause issues. So is it an estrogen deprivation problem, or is it because of lack of testosterone, and would testosterone make it better or make it worse? So sometimes it's just trying to ask all these questions. Sometimes we don't get all the answers, but yeah, it is just being aware that it could be because of other things.
Absolutely. And I know it's why we say getting a really clear picture of what's going on for you as an individual really helps to start to unpick some of these things. Someone's also asked around, in particular around research on testosterone and asthma. Just wondering, are there any other medical conditions people need to be aware of or think about in terms of that testosterone could potentially have an impact on, or is this again just about that individual conversation with their GP or menopause specialist?
So again, I'm not aware about testosterone impacting on other conditions like asthma. You know, I'll certainly go and have a look after this to see if there is any literature to do with that. But I just say to women that hormones impact women differently. And so, for example, if they start a testosterone or they start estrogen replacement and they notice something new, something different, it's important for us to try and work out if, you know, it could be as a side effect of the medication that she's using.
Yeah, okay. And just in terms of when people are finding this real challenge, I know you've covered this a bit in terms of talking to their GP, that seems to be the overriding frustration for people, where they feel that they've tried things or they're using estrogen, progesterone, and that's managing some of their symptoms, but libido and energy is still a challenge, but they're finding there's this real block with their GP to access that. Just kind of some practical tips on how people can really kind of advocate for themselves.
I think you've mentioned it, Sally and Deborah, many times about keeping a log of the symptoms you're experiencing, keeping a diary of, I've used my HRT, I'm happy with it, my hot flushes are improved, my joint pain is better, but I'm still experiencing a really low libido that just seemed to start towards the end of the perimenopause and the menopause, and it is continuing despite exercise and diet and doing all the things that would make a woman feel better in herself. And certainly going to the doctors, going to the GP to say, you know, I wonder if testosterone may be beneficial for me. Like I said, not everyone benefits with it and not everyone needs it, but I think it's sometimes worth a go in some women who, you know, are clear about the symptoms that they're experiencing.
Yeah.
Just wanted to ask, because this one's come up a couple of times in the chat, does estrogen help with libido?
Estrogen can help with libido. So just getting the estrogen replacement can make a woman feel so much better. And if we, as we've said already, libido is affected by how you feel just on a day-to-day basis. So libido can improve. Whether it helps with libido specifically is a separate issue. So, but yes, generally, estrogen can help with libido.
And I think I completely agree with what we're seeing in the chat. And I know Sally and I are watching what's a huge number of comments in chat. There's a lot that's saying about we need more research into testosterone. Now, I know about one research study that started, and I completely agree, because, you know, we're seeing lots of claims around it could do all of this, and we're seeing a lot of people saying, this is my experience, including one that says, like me, struggled really with acne, and when you've had acne you don't want to go back there again, it's nasty. So for me that was a bit of a oof, you know, that's a side effect too far. But it, you know, understanding it, getting under the skin of this once and for all would be absolutely amazing, wouldn't it?
I couldn't agree more. I think we need more research into both HRT, estrogen replacement, as well as testosterone. Because we have so many more women, Deborah, using HRT. Quite rightly, the numbers are still low, and more women wanting testosterone now. We need to be sure that we're offering women the right dose for them. We need to be sure about what we're treating. So we need research overall, but particularly, yeah, with testosterone replacement.
Yeah, someone's asked whether there's any natural ways to boost testosterone, so things like exercise, in particular strength exercise.
I don't know is the answer to that. I do absolutely say strength exercise is wonderful in the menopause and very, very helpful. Does it boost testosterone? I'll have to go and check that one, Sally. I don't know.
But I think in particular what you're saying around although there is a feeling that testosterone can boost things like bone density, the research isn't there, but we know that exercise, in particular strength exercise, can really help with that bone protection. Absolutely. And looking after our bones and our joints as we get older. So I think for anyone going through this stage of life, increasing your exercise, and in particular strength exercise, becomes really important.
Yeah, absolutely. Yes.
I'm just seeing if we've got any final questions. So people are talking about things like where they've got the kind of twitchy legs, or you know, that kind of where your legs won't kind of like the restless legs, and whether that's something that testosterone can help and support with. People in particular, someone's mentioned with fibromyalgia, is that a consideration?
I usually find that things like restless legs may respond better with estrogen replacement as opposed to testosterone. It's not usually something that's mentioned as being helped by testosterone. So if it isn't a symptom of something else going on and it's not being helped by HRT, then I wouldn't really expect it to be helped by testosterone replacement.
It's great, Sally, to see all of the comments in there, and we're getting a lot of comments coming through, and as you say, people supporting each other. I think it might be worth us doing a little bit of a recap, because we're getting a lot of comments about GP support. Now, we know so many amazing GPs, and we have so many people saying to us now that their GP was an absolute hero, but there are some things we can do ourselves to get the right support. And of course, you know, for those of us that are going to the NHS or even through private doctors, it is that whole making sure that we take the time to prepare for the meeting with your doctor, looking at your symptoms and saying what's actually different for me, and keeping a diary of them is absolutely key, because some things you might forget, might not feel important at the time, but it's really good to have that diary of symptoms so that you can say, well, actually, this is what I'm experiencing, and this is what I'm experiencing. Read up as well, because and I would say from trusted resources. I know My Menopause Centre has resources on the website, henpicked.net does too, Women's Health Concern. So not necessarily the headlines, but go to trusted expert and think about, actually, what do I want to do in all of this? Because some of us might say, well, actually, we want to take HRT. Others might say, well, actually, what's all the alternative? I want to think about that. So do the reading so that you can talk to the doctor around, this is what I'm experiencing. This is what I've been reading up. You know my medical history. What's your thoughts on this? Is a very different structure if you're well prepared. And then when you ring your doctors, always ask for, who is it in this practice that's had specialist training on menopause? Most practices, and certainly this is the aim, that most practices will have somebody who has got more of an interest or expertise in menopause than previously. And you know, if you don't get what you need, then do go back and ask for a second opinion, because you're entitled to one. And now for some of us, that might be ringing up on a different day and asking for a different doctor. But do make sure that you keep going back, because menopause is for a long time. You know, you don't want to be putting up with symptoms when you don't need to be, and that extra preparation can make all of the difference. So just recap on that. There's a document you can download actually on the henpicked.net website. I just wanted to do that quick recap, Sally. And it does lead into another question. We've had one question that says, somebody said, I've asked my GP for testosterone, and they said they're not trained up to prescribe testosterone. Are there different levels of training? I.e., I can give you estrogen, progesterone, but not that one.
Yes, and that's why in a lot of areas they would need a referral to a specialist menopause clinic for a specialist to initiate the testosterone. And even then, if a doctor is not comfortable or confident with prescribing testosterone, they may still not be able to prescribe it. But it's, you know, that was a wonderful recap, Deborah. It's back to those things that you've mentioned, asking for somebody who has an interest in menopause care. A lot of practices now will have someone. So it's doing your research yourself, you know, advocating for yourself and going in and speaking to somebody who has an interest.
Thank you very much, Dr. Tonye. Any final questions, Sally, or did we cover it?
No, I think there is there's definitely a frustration, and I think we can all appreciate this, and hopefully this will arm people with some additional information so they can really, as you say, advocate for themselves. And I think, you know, we all know we want there to be more research. We all know we want there to be more education. And I know there is a lot of work being done to focus on that education, in particular within GPs, and we, you know, really hope to see that improving. So just a huge thank you, and say thank you so much, everyone, for sharing and supporting each other. We always really appreciate it.
And I would also say congratulations to the team at My Menopause Centre, who have achieved, is it outstanding in the QCQ report? Now, I think it's worthwhile going and having a look at the website too there, because that's actually pretty awesome. Not every practice gets that, do they?
Thank you.
Congratulations to the team at My Menopause Centre. Thank you very much for joining us, Dr. Tonye, and thank you very much, Sally, for looking after the questions.
Thank you.
Thank you.
Have a great week, everyone.